Doctor, I wanted to ask you something. I was afraid the word Alzheimer's would emerge during the consultation because I haven't told my father what's wrong with him and he doesn't know, but I was wondering, is it worth telling him?
Generally, patients don't want to know. In your case, has your father ever asked you specifically, have I got Alzheimer's? Or has he asked you about the results of the tests we've done? MRI, PET, the spinal tap, and so on. Has your father ever asked about the test results?
No, I must say he's never wanted to know.
Generally, most patients don't ask, although some people do. But I'd say 90 to 95% of patients don't ask about the cause of their memory loss. I mean, they're certainly worried and anxious, but they just don't ask. So whether or not we use the word Alzheimer's is a choice. It's not a medical requirement. There are no specific guidelines on this. There are only very general guidelines which advise us to adapt our practice to the individual's cultural background and wishes. Now, in your father's case, if he's never asked or never shown signs of wanting to know, then I think that's an implicit request not to tell him. Not to say a word that seems to contain a death sentence within it. So the problem of telling the patient about the diagnosis is very delicate, and there can be no hard and fast rules of clinical practice about it. It has to be discussed between the doctor and the next of kin, or between the doctor and the patient when possible, and when and if the patient requests it. But in all cases, between the doctor and the next of kin, they have to decide a joint strategy and then use that to give the patient the amount of information they believe the patient wants to receive and is able to hear. So you see, there are cultural factors involved, and the strategy has to be tailored to the individual patient, because people's cultural backgrounds and sensibilities obviously vary quite widely.
Perché la sensibilità e il background culturale delle persone è molto diverso.